and welcome to Buyer for Health podcast, Heart Matters. I, Dr. Simran Kumar from Bayer, along with Dr. Alok, he is the HOD of Metro Health Sciences Faridabad, and Dr. Saran, who is the HOD of Aadhar Health Institute, Hissar, warmly welcome you to our podcast. Today, we will be discussing about chronic heart failure. What is chronic heart failure? What are the treatments available for this disease? And after the treatment, how many people still remain at the risk? And about the novel therapies, of course. As we all know, India has one of the largest proportion of heart failure people. And not only that, in India, patients suffer from heart-related diseases a decade younger than their Western counterparts. But before we dive in, I would want the help of my experts in understanding what exactly heart failure is. Dr. Alok, if I may ask you that what is actually heart failure? And we often hear about heart attack. So what is the difference between the two, sir?
Very good afternoon. Hi, I'm Dr. Alok Kumar. I'm a cardiac intensivist working at Metro Faridabad. As per the question you asked me, heart failure is a condition where the heart muscles they are not able to pump enough blood to meet the body demands. Basically the blood and the oxygen they are not reached to the limits which is required to person. Basically the heart is unable to keep up with its workload. This is chronic heart failure. Any acute event is heart attack.
Thank you so much, sir. Dr. Saran, when we talk about heart failure, we often hear about high blood pressure. कि high blood pressure है तो ही heart failure होगा. So if I would ask you that what are the other common causes of heart failure, and if my blood pressure is okay, will my heart not have a problem ever again?
Yeah, thank you, Simran. But contrary to this, blood pressure, high blood pressure is just one reason of having developing heart failure. This is not the most important or most common cause of heart failure. If we see the Indian population, the most common cause of heart failure as of now is the coronary artery disease. That is blockages in the heart muscles. Over the years, the blockages in heart vessels increase and gradually the pumping of the heart goes down and patient eventually land up into heart failure. So number one cause is coronary artery disease, that is blockages. Other than that, the other reasons are valvular heart disease, that may be since birth or patient may have acquired during their lifetime. When one or more valve of the heart starts malfunctioning, eventually patient lands up into heart failure. And some relatively less common causes, maybe some cardiomyopathies and other multiple reasons. So if we see blockages, that is coronary artery disease, valvular heart diseases, hypertension, diabetes, and cardiomyopathies. These are 5 important causes of heart failure in patients.
Thank you so much, sir, for sharing that. अब आंकड़ों की बात करें, if we talk about statistics, sir, so what do the statistics tell about the challenges that the patient of heart failure face? Dr. Alok, if you could tell us more about the statistics of heart failure.
See, about the statistics, India has one of the largest population of heart failure patient. People who had a recent heart attack, they are at higher risk. 73% of these patients, they face readmission or unfortunately death in 1 year of the discharge from the admission. The risk of death is 6 times higher in a heart failure hospitalization. And each recurrent hospitalization increases the risk significantly, and it leads to death also, underscoring the urgency of novel interventions.
Yes, sir. Thank you so much, sir. Dr. Saran, if I could understand a little bit that once I've been diagnosed, now what are my treatment options? So what are the treatment options for heart failure?
Yes. If we discuss about the treatment of heart failure, we can broadly divide it into three parts. The first one is lifestyle modification, that is on the part of the patients. So, any basic healthy lifestyles means quit smoking, reduce the fluid intake, reduce the salt intake, limit or avoid alcohol and coffee, be physically active. And these are the basic lifestyle modifications which one need to make. Second most important part is medicines. So what we call the treatment part is GDMT, that is guideline directed medical therapy. That is basically a combination of four or say five medicines which are given in adequate doses depending on patient's blood pressure, sugars, patient's heart rate, and we modifies the dose of these medications according to tolerance of the patient and symptom of the patient. And the third part then remains is interventions or devices. Once the patient is having a good healthy lifestyle, patient is receiving ZDMT, and if the patient still remains symptomatic, then we go on the intervention part. That may be in the form of intracardiac defibrillator or cardiac resynchronization therapy or something like that. So these are three broad modalities of treatment which the patient receives once he is diagnosed with heart failure.
Thank you so much, sir. Sir, but we often see that despite these treatments, some patients continue to deteriorate. So, Alok sir, if you could tell me a little that why are they deteriorating and what could be the other reasons of deterioration?
Yeah, exactly. See, the heart failure usually is a chronic condition. The course of the disease is characterized by the periods of deterioration, that is, some acute clinical conditions, acute heart failure. And after the correct treatment, when the patient receives, there is some improvement or stabilization of the clinical condition, which may occur. But even though the patient feels a bit better, the heart failure condition remains underlying. Here, they just miss the point. The chronic heart failure is ongoing. It's not out of the patient's body. You understand? The course of chronic heart failure is dynamic, with periods when patients sometimes feel stable and better, and suddenly they may get worse.
Thank you so much, sir. That's very insightful. So, Saran, Dr. Alok mentioned something that it is a dynamic condition. So, if I could understand more, that the patient, even if the patient is apparently fine, if he is able to walk, bathe, and perform his daily life activities, is still the patient at risk?
Yes. So if we talk about heart failure, this is not a curable disease in most of the cases. If we leave apart 5 or 10% cases where the LV dysfunction may be reversible, most of the patient, I say up to 80 to 90% patients are become better on treatment, but the disease still remains in their body. And so whatever treatment we offer, it doesn't cure the disease entirely. So as of now, if we talk, despite the best treatment options or best available guideline directed therapy, up to 12% patients will need either a hospitalization in subsequent year or may face death. So this is called residual risk. Residual risk means patient is receiving the guideline directed medical therapy. He is having a good lifestyle. He has received all the interventions or procedure which were recommended for his disease, but still there is some risk which patient always carries. And this part is where we can still offer the newer therapies or newer drugs which are being investigated, that how to bring down this residual risk to near zero. So still we are standing at somewhere between 10 to 15%. Despite all medical therapy, the residual risk remains so.
Thank you so much, sir. Alok, Dr. Saran mentioned about residual risk. So, exactly what is residual risk and how to mitigate this? So,
Thank you. Actually, see, in chronic heart failure, residual risk, it refers to the high risk of future adverse event which may occur, including hospitalization and death, that persist even after the patient has received optimized treatment. Okay. Recent clinical advances evidence shows that the rate of hospitalization and cardiovascular death remains substantial with GDMT in real world practice. For example, there was DAPA heart failure trial, okay, in which the patient treated with DAPA gliflozin still experienced cardiovascular death or hospitalization for heart failure at an annual rate of 12 per 100, 12 per 100 people. This is why it necessitates that there is need for some novel interventions.
Okay, thank you so much, sir. And sir, one of the things we all know that medicines definitely are the foundation, but lifestyle modification is the way to go. So I have two parts to this question. The first part, that a young person who still is fine and hasn't developed any heart failure signs and symptoms, what should be they doing so that they never develop a heart problem? And those who have already developed, so what should they do so that their symptoms are managed well, sir? If Dr. Saran could answer this one, sir.
So basically, we call this primary prevention and secondary prevention. Primary prevention means treating the disease or getting the measures so that we do not develop the disease at all. So if we talk about healthy persons who doesn't have any disease and who wants to stay away from cardiovascular disease, then the basic healthy lifestyles they have to follow. They have to maintain adequate body weight. They should have a good physical activity. They should have a healthy diet, and periodically they should monitor whether they are getting diabetes or hypertension or any other risk factors which can eventually land up into cardiac disease. So these are the preventive measures. We call it primary prevention. And what we talk about secondary prevention means the patient has risk factors for heart failure, or patient already has heart failure. So how to remain asymptomatic and how to remain healthy in that situation? In that situation, we have to follow a good exercise schedule. We have to maintain a healthy body weight. We have to restrict the fluid to according to symptoms of the patient. We have to reduce the sodium or salt intake. We should have a adequate dose as treated by the treating physician.
Thank you so much, sir. So one more question that is actually the buzz is that, we know that lifestyle modifications, healthy diet, healthy weight modifications is important. But recently we have seen some actors who are very young in their 40s still suffering from heart attacks or sudden cardiac death. So, sir, what could be the reason? Even in spite of being on the gym and everything, they are still facing. So what could be the reasons? Dr. Alok, if you could have this, answer this.
Sure, see, this is a very interesting question. But the basic problem is the heart failure or the heart related disease. See, there are two important points we have to see with that purview. First, it is a hereditary disease also. If your father, grandfather, or if your familial history is very strong for hypercholesteremia or CAD, whatever you do, you are prone to this disease, first of all. Second, you are talking about the actors, young actors doing gym and doing everything for the betterment. But they had these episodes. One very fine reason could be the protein intake or just to build up their body because it's a showbiz, you understand. They are taking a lot of supplement, which itself is very dangerous to our body. It should not be taken on the advice of a gym trainer or someone. It's better first you assess yourself with a doctor, see what are your blood profiles and how is your hereditary background. Then only you should go for all these things because we have seen this.
Yes, sir.
Oh, I thought I was out of the. No, that's all. Yeah, these are the main reason which is happening nowadays.
And Dr. Saran, would you want to add something on this, that the recent phenomena of young actors, dying from cardiovascular causes?
I think still that is the residual risk which we are seeing Delhi. Nowadays life is always under monitoring of CCTV cameras. 10 years back we were not having CCTV camera at every corner of the home or every corner of the street or gym. So still the sudden cardiac deaths were common earlier also. Today they are also there. Despite every healthy lifestyle, every one of us carries a substantial residual risk. So what we can do is with a healthy lifestyle, we can bring this residual risk to a lower side. We cannot eliminate it completely. So what we are seeing is the residual risk. There will be some cardiac death always there.
Okay. And sir, one last question is that how much water should we drink if we are suffering from heart failure? Because a lot of my grandparents and a lot of people in the older age, they think that drinking too much water is very good for health. So, sir, is it true? And what is the right amount of water we should drink for a heart failure patient?
No, if patient is asymptomatic, as such, fluid restriction is not advisable. Fluid restriction is for actually for those patients who remain dyspneic, who remain breathless despite the medical therapy. So for these patients, we should keep the fluid level around 2 to 2.5 liters. Very strict fluid restriction less than 1.5 liter is actually not beneficial. And 2 to 2.5 liter is for those who have persistent symptoms, and if patient is entirely asymptomatic, he should follow his thirst. He shouldn't follow a regime of 4 liter or 5 liter obviously, but he should drink according to his thirst if he doesn't have any breathlessness on ordinary activity.
Okay. Thank you so much, sir. Alok, sir, you would want to add something on fluid restrictions because you had a
So,
smile.
no, as Dr. Dharam said, he is absolutely right. The only thing which I have seen in the cardiac patient whose ejection fraction has been very low, like 20-25%, in those patients who has generalized edema or something, at that time, yeah, definitely it benefits to restrict some water intake. And maybe for till we optimize the patient with drugs, 1.5 liter is enough. I think, in my view, I think this is okay for them,
Yes, sir.
especially if their heart valves are involved.
Thank you. So thank you, Dr. Alok and Dr. Saran, for taking the time out from your busy schedules and being a part of this podcast. It is truly our privilege. And to our audience, hope you found the session very informative. But just a disclaimer, all the opinions and information here is only for awareness. So if you or your family member is suffering from a sign or symptom, please do refer a qualified healthcare professional. And in the end, I would like to thank you again, sir, for any more such to stay updated and for any such discussions I would and health related content. So please subscribe Buyer for Health and follow us on Instagram, YouTube, and on Facebook. Stay tuned. Stay tuned, and we'll see you the next time. Thank you so much, sir. Thank you.
Thank you.